The past 1.5 years has been the year of COVID-19 related drugs and treatments. And if you were wondering what kind of sales did COVID-19 drugs such as Remdesivir, Favipiravir and Tocilizumab generate, well then listen on. Here are some of the interesting stats that do come up. Interestingly, the COVID-19 drug which saw the highest sales in the past 1 year has been the antiviral medication Favipiravir, which is one of the cheapest COVID-19 drugs available, with at least 45 companies selling it. AWACS data indicates around 1,239 crores worth of Favipiravir was sold in the past 1 year. Pharma company Gilead's drug Remdesivir, which was licensed to be manufactured and sold by 7 companies in India, alone generated sales of around 930 crores in 1 year. Meanwhile, companies sold around 270 crores worth of ivermectin, the anti-parasitic drug which has been a big topic of debate in the treatment of COVID-19. As we have seen with vitamins and minerals, sales of COVID-19 drugs too mimicked COVID-19 waves. For example, Favipiravir sales spiked to almost 400 crores in April 2021, a jump of 24 times when compared to Feb before the second wave began. Similarly, companies sold just about 5.3 crores worth of ivermectin in Feb, which spiked to around 70 crores in April, and almost 14% of the drug Tocilizumab's past 1 year sales were just in the month of April. And as you can see, sales of the COVID-19 drug started petering off as the second wave ebbed, with sales falling 70 to 90% in July from the April levels. Now let's slice the data company-wise. First on Remdesivir. Of the 7 companies selling the drug, it seems Cipla, Zydus and Mylan generated the maximum sales from the drug. Cipla, for example, sold around 370 odd crores worth of Remdesivir in 1 year, Zydus around 230 crores, Mylan around 180 odd crores. The other companies such as DRL, Hetero and Sun were lower at around 40 to 60 crores. For Favipiravir, Glenmark's brand Fabiflu, it seems, has seen the most success. It generated sales of almost 900 crores in 1 year. And Cipla, the only company licensed by Roche to sell Tocilizumab in India, generated around 175 crores of sales from the drug in 1 year. So what is the expectation of COVID-19 drugs going forward? It depends on COVID-19 itself, say experts, and if and how severe a third wave might be. The other factor is treatment protocol. The second wave saw an arbitrary use of a combination of drugs. The government in its June guidelines advised for extreme caution with usage of drug Remdesivir, as it is based on limited scientific evidence. Tocilizumab, which is an off-label drug, hence meant only for severe and critically ill patients, and also removed the usage of drugs such as ivermectin. Also, this time we are better prepared. The second wave saw shortage of drugs due to slow production and hoarding. This time, the government has prepared an inventory of key drugs. Also, companies have been producing drugs such as Remdesivir, which takes for around 2 odd weeks for a batch, for export markets. Hence, one shouldn't expect any sudden shortages due to production constraints either.